We know what we have, let's hold on tight.
Hey guys, my name is Ashley and today I'm going to be doing my 35-week pregnancy update. I like to start with reading off a little bit about the baby and then about mom from my Ovia app, and then I'll get into my symptoms and how I felt this week. So starting off with the Ovia app, it says that as baby enters the home stretch, she's still just piling on baby fat at between 18 or 19 inches and 5 to 6 pounds, the size of a bunch of carrots. Baby is cuddlier than she has been yet, though she still has a little bit more to grow. She's really getting close to the size she's going to be at birth. So that is baby. And then I'll go over what it says about mom first, and then I'll show you the size of what the hand and foot is supposed to look like at this time. So then as far as mom, it says you might be squirting out a couple of drops every time you cough or sneeze, which I will get into shortly. So keep up those Kegels to help your body retain any fluids. It says you might be seeing an increase in vaginal discharge as well. Between the two, it may start to get a little messy down there. Pads are your best friends. It says the contractions are going to start getting more frequent, last longer, and be more painful. This is just your uterus prepping itself to give birth, so try to be patient. So that is what the Ovia app says. And let's get into, actually first let me show you what the hand looks like. So this is what the hand is supposed to look like right now. And there you go, you can see like the outline. And then as far as the foot, this is the foot. So baby is definitely growing. I'm pretty much a month away already from giving birth. So let's get into the symptoms and then what I am going to be doing this following week. So total weight gain right now is 9 pounds. And I did have an appointment today. Everything went well. She said weight gain is just fine and heart rate of baby's just fine. Blood pressure was just fine. So everything's going really, really well. Maternity clothes, as I mentioned in my previous videos, I haven't bought any new clothes. I'm not planning on buying any new clothes. So just whatever I fit into right now, my tights, I have two pairs of maternity shorts, and then some maternity shirts or just oversized shirts that I'm using. And yep, I haven't gone out to buy new clothes, and I don't plan on it for the last month, if I can help it. Stretch marks, no new stretch marks. I've continued to apply my belly butter every single day after a shower. And how am I sleeping? I'm still sleeping very well. I do notice though that obviously with the baby being lower and a lot more pressure on my bladder, I'm getting up like 4 or 5 times a night. Sometimes it can be difficult for me to fall back to sleep. I'll just get a little bit of insomnia sometimes, but other than having to get up to pee 4 or 5 times a night, I'm sleeping still pretty well. I have not needed to pull out my pregnancy pillow yet. Best moment this week, I would have to say the fact that I am almost completely done with my nesting list. I've already decluttered my closet, I've decluttered and cleaned the bathroom, and I've already got like my postpartum kit together. I just kind of need to fix it and organize it in my basket. Same with the breastfeeding essentials, and I've got the Snuggle Me all set up and washed. So just the fact that I've been able to scratch things off my nesting list has been very satisfying this week. Missing anything? I can't say that I really have missed anything. I guess I've just been so preoccupied with getting things ready for baby or I haven't really missed anything. So no, nothing this week. Movement, I have felt a ton of movement. Of course, when you lay straight on your back, then you'll notice that the baby starts to become more active. But even just kind of leaning back a little bit, or sometimes throughout the day, I'll feel like a foot or something poking out. But definitely a ton of movement. Food cravings, I can't say that I've had any new food cravings this week. Other than I've continued to crave spicy. Honestly, I can't think of any food cravings that I had this week. Again, I've just been so busy with preparing that I haven't really thought of anything that I've craved. Oh, yes, I've been craving wings for some reason. Wings, barbecue wings. That has been a craving for sure. I had wings like twice this week. So yes, wings have been my craving, along with spicy for this week. Labor signs, still no labor signs, thankfully. I did want to mention that my OB, I don't think I've really spoken about this, but this pregnancy, it was very hard finding a midwife that I could see this whole pregnancy. I started off with a midwife my first 2 months or so, and then she ended up leaving personal leave or something, and she hasn't come back, so I've been having to see the OB. But I've been between the OB and the nurse practitioner, so things have been a lot different this time around. And in the area that I'm at, I'm in South Texas, and there's not very many midwives, which was very disappointing because I enjoyed my whole pregnancy with my midwife, my first pregnancy, and now it's just been so different. They do things a lot differently. Again, I'm not trying to bash on OBs. I've just noticed a huge difference, and I'm trying to be patient and trying to get through with, I'm almost done, and I'm just things that I've noticed different. But anyway, the reason I mention that is because I had my 34-week, I'm up to monthly already, and I had my appointment at 34. I was almost 35 weeks already, and she did the GBS test, which was negative, by the way. Anyway, as she's doing it, she says, well, since I'm doing a swab test already, I can go ahead and check your cervix to see where you're at. And I'm like, whoa, wait a minute. I'm still very early on to even consider a cervix check. I don't want to check my cervix until I'm 39 weeks, if I need to. I don't want to have constant checks, and that's one of the biggest differences that I noticed with my midwife. I had one cervix check at 38 and 7, and I went into labor and had my baby at 39 and 1, and I had one cervix check, which I was 4 centimeters, and then my second was when they checked me and I was complete. So I had 2 the whole time, and I really want to avoid having multiple checks. So I let her know that I didn't want her to do that, and so she was okay with it. It's just kind of bugged me a little bit that she offered it so early on. But anyway, I denied that, and other than Braxton Hicks, I have not had any labor signs, no. Belly in or out, it's still in. I'm not really expecting it to become an outie anytime. Wedding rings, yes, they still fit. I'm still wearing my rings. Happy or moody, actually this week was a little bit rough, and I think that I may have just overdone it with all that I'm trying to prepare with. Today I'm doing very well, and yesterday I did well as well. But 3 days ago, for 2-3 days in a row, I found myself being very, very frustrated with any little thing. I started to get snippy at my husband, at my daughter, at my stepdaughters, and I just noticed that it wasn't me. There was something, I don't know if it was just the fact that we haven't gone out of the house, of course, and the fact that I'm preparing for the baby to come. I don't know if all of that kind of just piled on top, and it just kind of made me frustrated for a few days. I don't know, but I'm doing much better. So happy for the most part, but yes, I was a little moody for a few days. What I'm looking forward to is actually getting my hospital bag put together. Like I said, I've gotten the postpartum kit, and I've gotten the breastfeeding essentials, all of that taken care of. So just getting my hospital bag is very, very satisfying, knowing that after that, I just need to get my bag, the baby's bag, and then I'm pretty much set. So then I can kind of kick back, if you will, and enjoy the last month with my daughters and my husband, and just know that I am fully prepared. Just kidding. I'm actually editing this video, and I realized that I did not talk about symptoms. I have no idea how in the world I skipped over that. But as the Ovia app said, the two main symptoms I've experienced for this week have been the need to urinate very, very often. And I'm talking every 5 minutes, I feel like I have to go. I can definitely tell that baby is very low, and there's just so much pressure down there. And it's not pressure like I'm going into labor pressure. It's just pressure like when you need to pee. So I'm dealing with that. And then also I have noticed a lot of vaginal discharge. Again, nothing that is alarming that I feel like could be labor, but definitely a lot more discharge. And then other symptoms, I would say that that's about it. Those two are the main ones. I haven't dealt with swelling, thank goodness. And yeah, I mean, that's pretty much it. Sorry for missing that earlier, but those are my symptoms for this week. So now let's get into the belly shot. Okay, and this is what my 35-week bump looks like. My doctor actually mentioned today that she's so used to seeing a big belly when it comes to someone that's almost 9 months. But the fact that I'm tall, I have a long torso, I just feel like a lot of that is the reason why the baby's kind of just hidden there. Because I do have to say that my first pregnancy, I looked this, my belly didn't get very huge, but I had an 8-pound, 1-ounce baby. So there's definitely still room in there for the baby to grow. And I could definitely still have another 8-pound baby, so we shall see. So that is it. Overall, another great week. I look forward to sharing my next couple of week updates, and we shall see when this baby decides to make her grand entrance. So thanks again for watching. I will see you in next week's update for my 36-week update. Bye.
But things are finally right.